Hi, my name is Zoe, and today we will be walking through esolutionsONE's Fraud, Waste, and Abuse Workspace. FWA management is the manual processing of claims identified for abusive or incorrect practices, such as intentionally lying to a healthcare insurance provider, careless overuse of health services, and not following medical best practices. Rules set within the claims adjudication system will flag claims based on defined characteristics or patterns. Reviewing fraud, waste, and abuse is an enterprise-wide activity that requires visibility and continuity between internal and external systems. Today, we will be focusing on two main roles that will work through this process. Terry, a fraud analyst with simple access to all assigned work, conducting research to provide a final determination for the claim. Analysts rely on various systems of record to accurately verify the claim. And Beth, the approving manager who has visibility over the entire FWA process, getting notified when approvals are required and SLAs are breached. Currently, many healthcare payer organizations use slow manual methods to process flagged claims. This leads to rising costs and inaccuracies due to no defined process for pulling in necessary data. To aid Terry and Beth, the FWA Workspace will help process flag claims faster and more compliantly by integrating seamlessly with internal and external sources of record, providing a single pane of glass to work from and streamlining work across the enterprise. FWA Workspace is not replacing a claims platform, but rather a separate case management system triggered by claims flagged for fraud, waste, and abuse to be worked on by an analyst. Let's see it in action. Upon entering the analyst workspace, Terry at a glance can see all his cases and his team's cases. Advanced work assignment routes work to his inbox based on skills, availability, and work of previously worked cases, pushing work to the most qualified agent. Accepting the new case, he can review the claims details and updates from the claim processing system, such as responsible entry, investigation status, and rejection reason. Review the case activity and audit when changes have been made to the case. Reviewed record information, such as contact details, service level agreements, and the case timeline. Also available on the sidebar is Agent Assist, dynamically populating knowledge content based on the details to answer Terry's questions. He can then navigate to the playbook that guides him through a sequence of tasks to easily manage the life cycle of this case, such as reviewing the claim details, the practitioner information including location, specialties, submitted claims, and associated cases, and the patient information. Utilizing integrations to outside systems to pull additional resources into a uniform data model to easily review and ensure accuracy. He can interact with the patient and practitioner by email or phone, asking additional questions or for clinical documentation. Interaction records and emails getting tied to the case to enhance visibility for other analysts needing to work on the case or see history. After looking at all the information that was gathered, Terry begins to make his determination, starting by selecting key indicators that apply, making a billing determination, reviewing coding issues, treatment issues, and risk factors to confirm his investigation. Corrective action steps can be defined to mitigate future erroneous claims, for example, creating an education task to work with the provider on best practices, or referring the case to an outside agency to further the investigation, sending all necessary case details along with the request. Terry creates a new impact record to capture other claims that could be associated with his working case. Once completed, the case is ready for approval. Beth, the approving manager, can view her dashboard and get a complete picture of her analyst's progress. With different visualizations, she can define cases by investigation type, entities responsible for the investigation, approval, and many more metrics, all within a personalized view. Process optimization enables Beth to monitor and discover inefficiencies in the workflow, easily identifying bottlenecks and visualizing the case journey, detecting critical changes or problems that can create negative consequences on the business. Seeing Terry has requested approval, Beth reviews his work and can approve the case. Once closed, the case findings will be sent to the claims processing system and any outside organization defined during review. Fraud, Waste, and Abuse Workspace helps to remove the time consumption of manual processing. With it, we can ensure improvement in operational efficiency to maximize impact. enhance employer, group, employee, provider, and member experience, reduce healthcare payer financial loss, and mitigate risk by meeting more service level agreements. Thank you for watching eSolutions One's Fraud, Waste, and Abuse Workspace.